My name is Ezra. I'm a research associate at the Department of Psychology, and I'm joined by my friend and colleague Kevin Glasgow, who's a PhD candidate at the Department of Education. Today, we're going to talk to you about Generation COVID, a longitudinal insight into the impact of the pandemic, and how we are exploring this via our CocoaPip study. On the 11th of March 2020, the World Health Organization confirmed coronavirus as a pandemic. Happy 1-year anniversary, everyone. This resulted in countries all over the world imposing guidelines and restrictions to help curb the spread of the virus. Over the past 12 months, the government has tweaked this guidance. There have been some changes, for example, in the number of people we are able to interact with inside and outside our homes, and whether schools, shops and gyms are open. Whilst this guidance did differ between England, Scotland and Wales, overwhelmingly this message has stayed consistent. Stay at home, protect the NHS and save lives. I'm sure many of us can relate to knowing someone in the last 12 months who has conceived, been pregnant, given birth and now has a baby or infant at home, and you're yet to see the parents or meet their little one. More and more, we are seeing parents share their experiences of having and raising a child during this pandemic, and researchers are beginning to question the potential long-lasting influences on our children. In July of 2020, we created a study entitled COVID-19 in the context of pregnancy, infancy, and parenting. During the COVID-19 public health crisis, expectant and new parents have experienced unique physical and psychological stresses. We created this study with the overall aim of exploring how COVID-19 and its fluctuations in social distancing guidelines are impacting the development of our infants born during this pandemic. We are still recruiting, therefore, please do pass on the information to anyone who you think might be interested in joining our study. What Kevin and I are going to talk about today is our study CocoaPip, so COVID in the context of pregnancy, infancy and parenting. I will give an overview of the study and why we feel it's important, and then Kevin will go on to present findings from our first paper that has just been submitted for peer review based on the qualitative data we have from our ongoing work, exploring expectant parents' perceptions of healthcare and support during the COVID-19 pandemic. So the overarching thing is always, why is this research important? What's the point? We are born social creatures. From our early days, we begin to connect and collect information from our caregivers. For example, learning how to elicit shrills of excitement from our caregivers with our smiles and imitations of their facial expressions. The first 12 months of an infant's life is full of social development milestones such as making faces, recognizing others, as well as imitating their caregivers' moods. Whilst national lockdown measures and social distancing guidelines over the past 12 months has saved lives and helped curb the spread of infection, these guidelines may have long-lasting impact on the developing fetus and infant. Fetal and infant development can be influenced by a variety of factors, instigating a cascade of changes that shape later biological, physical, and neurodevelopmental outcomes. For example, we know that prenatal maternal stress and anxiety can influence fetal development and infant outcomes. Additionally, we know that early experiences are associated with later cognitive and social developmental outcomes in childhood. Whilst I use the term early experiences, these aren't just related or limited to parent-child interactions, but they also include family-orchestrated child experiences that are also important for enhancing a child's development. So what are we doing? Using a mixed methods design, we have developed a study with both quantitative and qualitative data, as we are keen to quantifiably measure infant development, whilst also giving parents a voice to be able to share their own experiences over the last 12 months. It is a logic-dependent and adaptive survey, showing questions relevant to parents' current situation and can be joined at any of the 3 time points highlighted in red, so during pregnancy, at 0 to 3 months, or 3 to 6 months. They are also given the option to opt in longitudinally, so we can follow their development from pregnancy all the way up to 18 months of age. During pregnancy, we collect information around fetal growth and parental experiences of their healthcare and support provided. At 0 to 3 months, we collect information about the infant's social development, as well as their postnatal healthcare and parents' experiences about giving birth during a pandemic. At the subsequent follow-ups, at 3 to 6, 12, and 18 months, we ask parents to complete questionnaires about their child's social, cognitive, and language development as markers of milestones, so we can see how their child has grown. So what are the overall aims? Overall, the aim of this study is to explore how the economic and psychological adjustments parents have had to take may potentially influence early parent-child interactions, physical growth, and cognitive development of the infant. Within the scope of our team and the expertise, we have split that into 4 main aims, which we'll be exploring. Aim 1, we're looking at the access to social, medical, and financial support amidst the COVID-19 pandemic, and how that's associated with parental stress, anxiety, and depression. Aim 2, we're looking at the COVID-19 restrictions and how that will moderate the depth and breadth of social interactions that a young infant has had during the first 6 months of their life. Aim 3, we're looking at parental mental health and social interaction and how that might mediate physical, social, and cognitive development in the infant over their first year of life. And then aim 4 is for those parents that we've been lucky enough to have from pregnancy through to the end of the study, where we're looking at fetal growth and how that might interact with maternal mental health and predict variability in infant social, affective, and cognitive development. This study is set to go on till, I believe, February of 2023, as we have to wait for our infants to grow. We have been lucky enough to have over 1,200 families from the UK complete the survey. Whilst it's important to note that this is open worldwide, and we've had families from Afghanistan all the way through to Australia, which aren't included in the data we're going to be presenting today, our data is predominantly from the UK. This survey is also open to all caregivers, not just mothers, as we'd like to give a voice to fathers, non-birth mothers, grandparents who also filled out the survey as well. To date, we've had about 400 parents complete the survey during their pregnancy, and about 900 parents complete between the ages of 0 to 6 months. And we are lucky enough to have about 900 of the 1,200 families agree to be contracted longitudinally as their infant gets older. So what I'm going to do now is I'm going to pass on to Kevin, who is going to discuss our recently submitted paper exploring parental experiences of that antenatal healthcare and support during the pandemic.
Thank you, Ezra. I will also share my screen. Okay, Ezra, if you're still there, can you confirm that you can see the slides?
Yep.
Great, perfect. Okay, thank you. So as Ezra introduced, my name is Kevin Glasgow, and I've been working with Ezra and the team on CocoaPip since around October 2020. So recently we've completed a paper which is now under peer review, and it's that paper that I want to talk about today. So the paper is titled Expectant Parents' Perceptions of Healthcare and Support During the COVID-19 in the UK, a thematic analysis. And I'll pick into what all of that means as we go through. Same problem. So just a quick run through of what I intend to talk about. I'm just going to give a little bit of background. Ezra's already laid the groundwork for that, but if I can just take it a few steps further specifically about this paper. I'll then just outline our objective of the paper, the methods that we used, the results, and then finally talk about some implications, and then hopefully have some questions at the end, if people would like. So a bit of background. The pandemic has affected the whole host of society across the spectrum, but one thing that we've seen quite commonly reported across the literature is a variety of themes, such as antenatal maternity services for expectant parents being negatively affected by the COVID-19 pandemic, We've also seen a distinct regional difference in variations of support levels available to families. There's also been huge controversy to do with birth partner attendance. This actually resulted in a political campaign that has now since been overturned, which happened as we were writing the paper, which was something we were excited about, where birth partners are now allowed to attend appointment and birth, which was something that we were personally quite excited about, and hopefully that'll come across why we were excited when you see the data. There's also really sadly been an increase in stillbirths. That's not something we've been looking at particularly, but it does give context as the kind of emotional background of what's going on for a lot of women during this period. There's also been a reported lack of care. I will touch on specific nuances of what I mean by lack of care as we go through. And finally, and concerningly, there's also been high levels of anxiety and depression reported specifically within pregnant women and new parents. I guess the other important background to highlight today is of course, Mother's Day. So it seems quite pertinent that we be giving this talk today. So happy Mother's Day to all of the mothers out there. So our objective was to examine how COVID-19 and its societal related restrictions have impacted the provision of healthcare support for pregnant women during the COVID-19 pandemic, whilst the COCOPIT study as a whole looks right across the spectrum from pregnancy all the way through to 18 months. In this paper, we were particularly interested in the antenatal period. So that's what this paper focused on. However, please stay involved with COCOPIP as we have other studies due to come out looking at the rest of the data. So the questions that I was responsible for working with alongside Ezra were qualitative in nature. The survey is mixed methods and it has a whole host of questions, but specifically these 6 questions were the ones that I was interested in. I'll let you have a look at them. Essentially, they're wanting to know about experience. So the experience of healthcare providers during pregnancy, do you feel comfortable? Has talking to your midwife online allowed you to ask the questions you wanted to and made you feel at ease? We've asked a little bit about the experience of COVID-19 itself. We've also asked about online classes. Did you attend them? How useful did you find them? And then finally, prior to birth, were you certain whether partners and or family members could be present for the birth? Coming back to the fact that we knew in the literature and in wider society that the presence of birth partners was a particularly controversial experience for women and families at this time. So the methods that we used, I used a thematic analysis of the data and a sentiment analysis. A quick overview of what I mean by those, because I know that they're sometimes new to people. The first step was to do a thematic analysis. This involved reading the transcripts of the interviews countless times, leaving them, reading them, leaving them, reading them again, until I felt I was really familiar with the content that was within them. After that, I went through using it in vivo and started to code out specific phrases and sentences that started to link to other women's responses. In this way, I started to build a hierarchy of themes, which eventually led to overarching themes that helped to represent the whole data. Another aspect of analysis that we conducted was a sentiment analysis. And by that, I mean, what percentage of the sentiment in the text was positive, neutral, or negative. And I used Atlas TI software originally to do that and then conducted it manually just for certainty as well. So the findings, I'll give a brief introduction to them and then I'll explain about peer review, but the findings had some main key themes. The first one was that there was anxiety in relation to healthcare support. We also saw that there were changes to healthcare support. We also saw that there was a lot of talk about rushed and fewer appointments, mentions of lack of sympathy, restrictions on partners attending, lack of face-to-face, and then finally the use of PPE. And it was these themes that we used to structure our report, which is now under peer review, which brings me nicely on to a request. Just to let you know that from this point on, our findings are sensitive and controversial and confidential, not controversial, confidential, sorry, as they are under peer review. So please just bear that in mind when you look at them and if that's okay. So what I'd like to do is present the women's voices themselves. I think what's really important to get across here is that we were interested in women's experiences. And the reason why we chose to do a thematic analysis and a qualitative analysis is because ultimately we want this to be emancipatory. We want the women's voices to cut through more than our own voices as researchers. So the best way that I feel that I can do this is to present the women's quotes directly, read them and allow you to interpret them as you will, in that way giving voice to our participants. So what I hope this data has shown is that there is a lot of emotive language being used, and this represents a lot of emotions within the group that we were studying. From the results, you can probably already start to draw your own implications and conclusions. We were lucky enough that one of the implications we would hope for would be the attendance of birth partners. That's something that has since happened. Further implications is that what this study has highlighted is that pregnancy care needs to be specific and unique to each mother and each family's individual case being very different. We've also corroborated the idea that there is variation depending on different women's experiences. Not all women had perhaps the negative experience that I presented, although the majority was that, with 50.1% of sentiment being negative. But finally, the implications also show that there are many things we can learn about how to adapt should we be in this situation again. So things that we might be looking to see in the future would be obviously practical things for the healthcare system, such as the correct use of PPE, adapting and learning how online interactions work and how they work well, birth partners continuing to be in attendance, and you get the idea that the list could go on from these. What I hope this has allowed you to do is to get a glimpse into the experience of what these women are reporting and experiencing throughout their time in COVID. And I hope it will allow you to reflect and draw your own implications and own expectations of what you think we should do in the next steps. Following on from this, we're continuing to work on data which will follow these women through. We hope to see whether these issues are changing throughout time, whether mothers recruited later in the survey are still reporting the same things, or whether things have changed. So it's definitely something to stick with and keep an eye on, because the results that are coming out are ever updating and ever changing, much like the COVID-19 pandemic. So finally, I would just like to say thank you for listening. Thank you on behalf of all the women who took part in our survey, and thank you for listening to their voices. As at the core, that's what we want to get across. Thank you.
Dr. Aydin and Mr. Glasgow, many thanks for your talk. And now it's time for the Q&A. So if there are any questions, you can write them to the YouTube chat, or you can ask in the Zoom call.
Sorry, I just wonder if I could ask a question to you through Zoom. So I think it's an incredibly important piece of research, and thank you very much for your presentation. I really enjoyed it, and it was fascinating to learn about your findings. I'm not very familiar with your methodology, so I was just wondering if there was any way for you to discover some positive aspects. I wasn't surprised that obviously COVID led to a lot of negative experiences, but I wondered if it also brought out compassion from people, and if you found that, and how in the way of asking your questions you could elicit these positive responses and more positive experiences.
Sure. Ezra, will I jump in on that? Yeah. So I guess something to consider with this data is the data point at which we analysed was the absolute peak pandemic. It's obviously unsurprising that there's likely to be much more negative responses than positive. We did see 21.8% positive sentiment across all statements versus 50.1% negative. I think one limitation is that quite often if you ask people their opinion, the people who are most likely to want to give their opinion are the people who most likely are wanting to express a problem. That is definitely true. That we see that in surveys a lot. So how do we combat that? Well, I think what will be interesting to see is whether once the kind of war zone, as it were, they're out of, and we follow them up longitudinally, is there a reflection on what's already been said, and do things change? I should also say that we are collecting data at different points. For example, a work we're doing just now on Christmas and the period there, it has been really interesting to see that simply due to the change in the time of year, that there is more positive sentiment. For example, women talking about the fact that Christmas in lockdown has actually been a relief for some people because it's meant they've not had to travel the length and the breadth of the country, things like that. So I think it's a combination of A, the situation was dire, 2, you're more likely to fill out the survey if you have something bad to say, but 3, hopefully what we'll start to see is a more broad perspective as we follow these parents up longitudinally, would be my thoughts on it.
Thank you very much. Thank you.
Oh, we are running out of time, so last question. There's one question in the YouTube chat, so this will be the last question. Thank you for your talk. Was there a difference in sentiment depending on the age of participants? I'm interested to see if age improves capacity to cope with unforeseen circumstances.
That's a really, really good question. So we did have a big age range spread. We didn't cross-tabulate experience with age. That's not something we did in this paper. However, I think it does raise a really interesting question, which age group are most likely to have the most positive sentiment and negative sentiment. Unfortunately, that's something we've not found the answer to. It's something that maybe in the future we should consider, but I think that's a really, really great question. Ezra, I don't know, do you have anything you want to add?
No.
So, Dr. Aydin and Mr. Glasgow, many thanks for your talk again, and thank you for answering the questions.
Thank you.
Thank you for having us.
Thanks.